Hi.
My name is Hubert. I'm gonna be a nurse student today. How you doing?
I'm doing good. How
Uh,
about yourself?
okay. I'm gonna wash your hands. Okay. Can you tell me your name and your date of birth?
Yeah, sure. It's Johnny Ramirez, June 11th, 1997.
All right. That's perfect. Exactly. That's what it is. Yeah. Um. So today I'm gonna do an assessment, physical assessment for you to head to toe. So are you comfortable? You ready? So you wanted to do it? Okay. So I'm gonna raise the bed first. Make sure that it's my waist size. Your vital sign earlier and everything looks normal. But we're gonna move on and continue our our head to toe assessment, physical assessment. Is that okay with you?
Yeah.
Okay. I'm gonna ask you a few questions. They might seem a little bit silly, but they'll help me to move on in my assessment. Can you tell me your name, the where you are, and the reason why you are, and the time?
Okay, so my name is Johnny Ramirez. I think it's about 5 o'clock right now. I'm at the clinic and I'm here for my routine checkup.
All right, sounds okay. So the patients are alert and the oriented time full. Okay, can you tell me your mood right now?
Oh, I feel great.
You feel
Yeah,
great?
I feel great.
And what do you have any pain?
No, no pain.
Okay, well, sounds good. Okay. So now I'm gonna check your cranial nerve. See, can you smile a little bit for me? So okay, so the patient's like cranial nerve is 7, look good. He's grooming, and his clothing, everything looks good. Do you have any like a mobility edge, like any osteotomy?
No,
No?
I'm pretty ambulatory and I don't have any drains or anything to worry about.
All right. Okay. Sounds good. Ramirez. Now I'm gonna assess your head, your face, and your nerves. Is that okay if I touch you?
Mm-hmm.
Okay. Do you feel any tenderness? Any bump around?
No.
Okay, now Mr. Ramirez, I'm gonna check your ears to see if there's like any drainage stuff like that. Let's look inside. Okay, looks very clear. The next one too. That's very clear. Okay, now I'm gonna have you close one ear and then okay, repeat what I said. 312.
312
Okay, this one. 462.
462.
Okay, sounds good. Now I'm gonna assess your nerves. I'm gonna have you raise your head up a little bit. I'm gonna check for any mucous membrane. They looks great. Yeah, they all look good. Okay. All right. Thank you very much. All right. Okay. Okay. Now, Mr. Let me check your the jugular venous distinction. All right. The other side. All right. No sign. Everything looks good. Symmetrical. No jugular venous distinction. Thank you very much. Mr. Ramirez, now we're gonna assess your respiratory function. We're gonna start it for the accessory muscle. Let me look at your posterior thorax. Okay, it looks symmetrical. I don't see any sign of deformity, abnormality. So it looks good. Okay. All right. No expansion. Okay. Now I'm gonna start it. Ausculting your lung sound. Okay. 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 Let me start it like this. I'm gonna use my diagram. All right. I didn't hear any abnormal sounds. Now we're gonna assess your anterior thorax. any last sound from your interior. All right. Everything looks normal, no abnormal sounds. You didn't use any no extra muscle use for for respiration. So assess your cardiac function. Is that okay? We're gonna ask you to take your landmark, your heart landmarks. Listen for abnormally sounds. Is that okay? Okay, I'm gonna use the diagram. Now I'm auscultating the second left. No. The second right sternal intercostal, the aortic. And then I'm auscultating the pulmonic sound, the second left intercostal space. Okay, now let's listen to your hertz points, the third left intercostal space. Okay. Now your fourth intercostal space. You listen to the tricuspid sound. And then the last one, let's listen to your okay, your fifth intercostal or left intercostal space. Listen to for the mid clavicular mitral sound. Okay. Now let's look the bell to see if we hear any murmur. Alright, looks good. No abnormal sounds. Now we check your femoral, your femoral pulse, and then we check for your capillary fill. Yeah, I'm going for the capillary fill. Oh, okay. Capillary fill, less than 3 seconds. And that's your lower, your upper extremity. Okay, capillary fill, less than 3 seconds. And then no sign of sacral or I'll tell you 3 words and try to repeat it after me, okay? Mango, banana, and orange.
Mango, banana, orange.
Okay. I'm gonna try to check for your pupils and see how they accommodate and react to light. Okay. Your pupils, your pupil react to the lights and accommodation. Okay, they are equal. React to the lights and accommodation. Okay, now we're gonna move on to the. I'm gonna have you stand up. I'm gonna check your balance. Okay. Can you walk over there for me and come back? Alright. Now you're gonna walk over there, but now toe to your ankle. Not like this. Your toe to your ankle and then here. Alright. Now come back. Have a seat for me. I think the patient's gait balance is okay. Now we're gonna observe your lateral, your spine. Can you stand up and bend over for me? Okay. Mr. Odu, your spine cord in the normal limits. Okay. Thank you. Okay. Can you have a seat? Okay. Now I'm gonna palpate your joints and see how they look. Okay. And your joints and your muscle group and lower and upper extremity is in the normal limit. Okay. Okay. So now we're gonna check for your muscle strength. All right. Can I have your hands, please?
Oh, my hands, okay.
Straight like this. Can you pull over? Okay. Like this. Like this. Can I have you both hands like this for me? Can you try to raise it? Okay. And then let me have your. Okay, try to forward. Okay. Okay. Now try to do it. Okay. Sounds good. Your lower upper extremity, lower and upper extremity looks good. Normal limits to resistance. Lastly, we're gonna perform a range of motion. Can you have your arm up for me? Up. Okay. Down, the sides. Okay, good. And then you have your foot. Okay, try to move it up toward the body, away. All right. The range of motion looks good in the normal limit. We're gonna assess your abdomen. Okay, sounds good. Okay. I don't have any scar. Even your hair, it looks normal. The skin looks normal. Okay, I'm just looking. Okay. Now I'm gonna ask you, okay? Okay. Starting for the the right lower quadrant, right here. Okay. The upper lower quadrant. All right. Now I'm gonna move to the left upper quadrant. All right, and lastly, your left lower quadrant. Okay. It looks your bowel sounds at normal sounds, no upper or no hypo or upper active sound. Okay. Okay. Now I'm gonna palpate. Tell me if you feel any pain. Okay. Any pain?
No.
Alright. Any pain? Any pain? Any pain? Mr. Ramirez, we almost done here. So lastly, I'm gonna assess your integumentary, your skin. It pretty much overall looks normal, and there's no redness. I don't see anything. Okay, now I'm gonna pinch your skin by the clavicle a little bit to check for vinegar. Okay, so that means there's no hydration. Okay, okay, looks good. Now let's move on. It's okay if I palpate to check your temperature. Okay, it's warm, it's good. Let me check for your nails. It looks normal, very pretty. The nail bed, they are clean. There's no obstruction. Okay, and no blanching of the skin. All right. So that concludes our physical assessment from head to toe. I'm just gonna wash my hand and do some documents. All right. Thank you, Mr. Ramirez. Dr. Ricard, see you.
Thank you.
you.